Let's speak to Jamie Jenkins, former head of health analysis at the Office for National Statistics. I'm kind of looking through my fingers, Jamie, to listen to this answer. Are we past that peak, do you think?
Well, quite possibly, Gareth. If you look at the data in Wales now, and then you just mentioned Scotland as well, because every time, if you track since the start of the pandemic, we start seeing the curve down in the cases per 100,000. Every time we've seen that, we've then had this sustained fall and this continue to go down. And I think just a few things for the latest data, which is different to what we've had in the past. We have had the schools closing, which is quite an important factor for two reasons. One is that there's much less testing going on. So we're doing about 10,000 tests a day less in Wales than we were about 2 weeks ago when the schools were fully open. And when you're testing fewer people, you will pick up fewer cases. So that's why the cases per 100,000 is dipping a little bit. But there's two metrics. The other one that's important to focus on is the positivity rate, which is the percentage of tests coming back positive. Now, that was going up, and that's eased off. And at Wales at the moment, Gareth, about 11%. And Scotland peaked up, but not far off that, 10.8%. And they started seeing cases come down about 10 days after the schools closed there. And they had a sustained rate coming down, and they're now on 6.8%. So if Wales kind of follows what Scotland does, and England's looking in the same direction as well, it could be that we're heading downwards, which is obviously good news.
Any caveats on that with regard to, we know the border's porous. England opened up pretty much fully, didn't they, last Monday? Have those figures, has any effect of that come through into the figures yet?
So we haven't seen an effect of that. There will be a bit of a lag. Now, I know there were some images of nightclubs opening at kind of midnight on the Monday where kind of people were starting to go out and enjoy their Freedom Day in England. So it would have been the weekend just gone where the full thing would have happened with regards to, I think we've seen festivals open in England. So I suppose what Mark Drakeford in Wales will have is as an early insight as to the full unlocking in England. If we're tracking both down at the moment and continuing with Scotland as well, if we see all the kind of the concerts opening up, theatres and more indoor mixing going on, if there's an uptick in England because of that, we will probably see that before the announcement in Wales for the 7th of August date. So I suppose that's a little bit of an insurance policy the First Minister's got. Still too early to tell, but hopefully we'll continue on that nice positive trend across both nations.
And look, if cases continue to dip, and fingers crossed they do, would you expect, nonetheless, hospitalisations and deaths to keep going up for a while because of that lag?
They probably will, because there's always that little bit of a lag, because people who are going into hospital now will be people who caught the virus probably about a week ago, and some of the deaths that we're seeing are people who caught the virus 2 weeks ago. But there's some good news from all of that as well. In Wales today, the ONS have published the latest figures on total deaths across the country, and they're still below average for the time of year, which is a positive sign there. And I've been tracking waves 2 and 3, Gareth, and if you look at the average deaths, they are relatively low in Wales. You do get some days where 4 are announced, but that doesn't mean 4 happened the day before. Sometimes they're from several days ago. So if we track waves 2 and 3, we've got an average of 1 death a day at the moment in Wales. At the same time, in waves 2, it was 10. So we've kind of come down 90% there. And we've got 155 patients in hospital now. And in wave 2, it was over 700. So you can clearly see that the vaccine effect is having a great effect in terms of keeping the numbers low. They'll probably go up for a few weeks. And then if we have peaked out, within about 5 to 10 days, they should start coming down as well.
Fingers crossed. Lovely to speak to you, Jamie. Thanks very much indeed. That's Jamie Jenkins.